Finding the right provider for your kids when you need them can be a confusing and lengthy process. Dr. Allyson Coffin walks us through it and a whole lot more, plus a pro tip to avoid potentially long waits to see a specialist on Raising Me.
Okay, Allyson, thank you so much for coming back and chatting with us about this, because this is, on the surface, it seems simple, right? How to choose the right provider and figure this out when it comes to your kids. But then you dig into it and there is a layer of complexity that can kind of make your eyes glaze over. So
yes, definitely.
Help us understand the different provider types when it comes to getting the care for our kids.
Okay, so there's lots of different types of people that your kids can see, and they're not all doctors. So your primary care provider is the person that you see, like your pediatrician, or it's the pediatrician. It's the person that you see over and over and over again. That's your primary care provider. And so when someone says, see your primary care, that's the person that you're supposed to talk to. But when you have a specialized issue, let's say it is speech, it is gross motor development, it is postural, it is mental health, there are different people that you should be seeing. Our primary care provider, that's not their job. Their job is not to treat our mental health issues or our developmental milestones that are not being reached.
I think that's a really important point.
Yeah.
And as we were talking leading up to this, I just had this vision of like your primary care physician kind of is a director or, I think of it as a train station. And then their job is to send you on a train in the right direction.
Yes.
Depending on whatever it might be.
Yes, that's what they do.
Okay.
Yes.
So primary care versus specialist. A specialist might be who?
Okay, so there's hundreds of specialists. Okay. So a cardiac specialist, that would be a certain kind of specialist. A pediatric occupational therapist, a pediatric...
I'm sorry, wait a minute. A pediatric occupational therapist.
Yes.
What would that look like?
Okay, so you think of like a physical therapist is for like muscular movement. An occupational therapist is really like a whole sensory profile of a child.
Okay.
A lot of us have kids that have sensory issues or sound issues, and you would see an occupational therapist for that.
Okay.
And the very cool thing now is that you don't always need a referral to see these people. So you can seek out these specialists on your own.
Okay, so what are some of the other specialists? And then how do we know when we need a referral and when we don't?
Just a tiny little synopsis about insurance is that so if you're going to use your insurance and if you have an HMO policy, you need a referral. So you have to ask for one or your insurance will not cover it.
Okay.
Usually, you don't need a referral. So you call the place, have them look up your insurance, if they take insurance, and if you need a referral, they'll tell you. So it's really not that tricky. And most places do all that stuff for you.
It does sometimes, though, seem daunting.
Yes.
When you're like, oh, wait, I have to get a referral. That means I need to go to the pediatrician first, which means then I need to get a referral from the pediatrician and they'll refer me to whoever. Then you're on a waiting list in a lot of cases.
Yes. Yeah. A cool way to circumvent that very annoying situation is...
So I wasn't going to say that, but
it's the truth.
It can be. It can just be daunting.
Yeah, you want to get the care for your kid now.
Of course.
You don't want to wait forever. So what you do is you call the place that you want to go to, and then they can reach out to your primary care, and that's always very fast.
Pro tip.
Yes.
Okay. So say your child, maybe has asthma. I
totally.
First thing off the top of my head, you would call the specialist.
Yes.
For asthma, and then they take it into their own hands or whatever it might be.
Yeah. Or if they can't, they'll be like, okay, call this number, have them fax it here. So you don't have to do this whole dance.
You skip a step almost.
Yes.
It's kind of sidestepping a little. It's kind of cutting to the front of the line.
Yes. Fancy.
Okay. All right. Okay. So other specialists might include.
Okay, so there's lots of different specialists. So, but they're
most common.
Most common would be a mental health specialist. So lots of kids see play therapists. They think it's very hard to find a mental health expert for kids, but you can do things like go to Psychology Today, look up the person that you're looking for, and then click a button and ask if they're taking new patients. They'll tell you if you need a referral or not. The best way to find somebody that's a good fit for your family is to ask your friends. So if they have a good relationship with another provider, they'll tell you. So you get to skip the step of like having the awkward, like, I don't really like this place and I don't want to come back, you know? And you want to have a great place for your kid to go to. And you want to feel like the doctor's paying attention to you, or not the doctor, maybe just the specialist is paying attention to you and like vibes with your kid properly and like sees them for who they are. So asking your friends is really an awesome way to know if they're a good fit or not.
And then you have to obviously see if they're seeing new patients and all the things. Yeah. But you're right. I mean, that would be a great, because you trust your friends, hopefully.
Yes.
And the referrals are a great way to do that. Routine checkups at this point are pretty much once a year.
Yeah.
For kids still.
Yep. So they still do those about once a year. And then some kids that do sports need physicals. So this actually
the key is to do that when you're at the yearly appointment and not have to go back, because I've definitely had to go back.
This is a new thing that I think has just happened a couple months ago, is that if you're going to sports, say your kids is still at the pediatrician and they're going to college for sports and they need to have that physical exam, it's a 6-month window now. So make your appointment accordingly.
Oh, wow.
Yeah.
Okay. What about like, I've thought about this, is urgent care versus emergency care. Like, I mean, there are going to be very, very clear signs that you need an emergency room.
Yes.
But how should we differentiate between an urgent care will take care of an urgent situation versus going to an emergency room?
Urgent care is a great place if you're like, I have the flu. Can you check and see if I have the flu? They'll swab your nose and tell you if you actually have the flu. My kid has an ear infection and say you don't have access to your primary care or your chiropractor to check your ears. Then you go there and they can prescribe you the medicine that you need if you need to do that. Those are reasons to go there. You need to go to the emergency room if it is life-threatening. So if you have a broken bone, you want to go to the emergency room. If your kid has extreme pain and is throwing up and you think they might have appendicitis, go to the emergency room. Mm-hmm. If they have a fever that's incredibly high, if they have a seizure, do not go to urgent care. Go to the emergency room.
Right. So very clear. Very clear when it comes to the emergency room. What about when it comes to developmental concerns?
Yes, I love talking about this. Okay. So developmentally, we watch our kids from the time that they are born until they leave our house. So the time that they're born, you kind of like know how their body moves or doesn't really move because they're kind of mushy when they're first born. And then they start to do things. So they start to hold their head up, then they start to sit up, then they start to crawl and all these things. And if your kids are not hitting those milestones, so they happen to just not crawl, or they happen to not really be interested in walking when they're 1.5 years old, that's the time you need to get an evaluation. So you want to you can, of course, talk to your primary care, but that's the time you want to see either a chiropractor, a physical therapist, or an occupational therapist to have your kid evaluated to make sure there's no structural problems. A chiropractor would make sure there's no structural problems with like the hips and the low backs, meaning they can't literally walk because there's something going on with it. But you just wouldn't know because kids adapt. They'll like scoot across the floor forever.
And they don't know the difference, right? So they're
happy as a clam. They think it's great. And then you could see a physical therapist and they would do some evaluations of some reflexes that many people don't know about. So they're called primitive reflexes. So now when you're born as a baby, you have these primitive reflexes. So if like you touch your baby's bottom of their foot, their toes flare out. That happens on every single baby. And there's tons of other ones. And those are supposed to go away when your body gets a little bit older and like your nerves start to get what's called myelinated, so covered in fat. But if those stay, then you have like some other things show up. You could have some behavioral issues. You could have,
interesting.
There's so many different things that show up with this. So a physical therapist would be a good place to stop and have somebody take a little look at those. An occupational therapist is amazing at checking those types of reflexes. And then there's other therapists. There's this technique called Muscatova where they check those specific reflexes to make sure that they're integrated properly, and they'll tell you how to do it at home. So you can do these things at home.
But again, do you need to start with your primary?
No.
Or with this, you can
go
straight to, if you have developmental concerns like what you're talking about, you can go to these specialists.
And they'll send the notes to your primary. Yeah. Everybody would do that. And so then your primary is already looped in. And if you need a referral, they'll send it.
Okay.
Yeah.
I want to talk a little bit about like behavioral and mental health. We've talked about that a lot. We know there's an anxiety epidemic among young people. Mm-hmm. How do we find the right person to treat our kids? Are there things that we should keep in mind when it comes to finding the right provider for mental health and behavioral health?
Yes. So you want to find somebody that specializes in the age of those children. Okay. So say your kid is like 10 and under. Usually you want to see somebody that's a play therapist because kids express their emotions through play. So you'd look for a play therapist to treat them. A kid is not going to sit there and talk to somebody all day long.
Right.
They just don't do that.
And do you know, like, what would be a sign of trouble when they're playing? Like, how would they evaluate play is off? I
have interviewed play therapists to see, I'm like, how do you know that?
Yeah, right. It's fascinating.
So kids' language is in play. So say they're playing with, for example, say they're playing with Legos and they're fighting with the Legos. That's happening in their real life. They won't say, my friends and I are fighting, but they will act it out that way. And then the play therapist is incredibly skilled on to help bring in regulation strategies into that session. And the kids integrate it and learn how to do it without sitting there and talking about it. They're not okay, these are the skills and this is the XYZ you need to do. They integrate it into the therapy session. Mm-hmm. And then let's say...
So you don't even realize you're getting therapy. This is part of this conversation. Yeah.
Yes. Yeah, and then some kids are acutely aware of their mental state and they'll be like, why do I have to keep going to this play?
Well, right. And so that would be, like you were saying, around 10 or younger.
Yes.
What about 10 and older?
So that's the time that kids want to talk. So that's when you...
Or don't want to talk.
Well, they don't...
But they certainly have the language around it.
Correct. And so it's important to go do a first session with somebody if you want to see a therapist and see if it's a good fit. And if it's not, say it at the beginning and tell your kid it's okay. If you don't you don't want to see this person, if their a vibe is off or whatever they say, cool, we don't have to see them. And then you just switch to somebody else. And the therapists don't care either because they want it to be the right fit.
For them too.
For them too.
Because they want to make a difference, obviously.
100%. Yes.
I have heard anecdotally that it's very difficult to find a therapist right now, especially for young people.
It is. So there's... throughout the entire United States, you can go to Psychology Today and find a therapist that does a specific thing that you're looking for. So there's lots of different kinds of therapy. So you just type in what you're looking for and it will show up. And then you can just click the button and ask if they're taking new people. And then it's really helpful. I've had some kids that I see at my office that need a therapist and their parents will literally keep a spreadsheet, like a Google Doc spreadsheet. So you can keep track of all these people that you've asked for.
Wow.
It's tedious, but it's so you don't double do everything. You're not going to call the same place over and over again because they wait lists and you want to be at the top of that wait list if they're good.
Let's talk a little bit about parental instincts because that is, such an important thing. And it's very, it's kind of a double-edged sword because I think part of your parental instincts might be, well, I'm probably overreacting. Well, if I see something, maybe they'll outgrow it. But then when that deep part inside of you is saying, I don't know, my gut is telling me something isn't right. How important is it to listen to that inner voice that something isn't right?
It is the most important thing that you can do.
And not just mentally, but physically too.
100%.
Okay.
So if you think something is off, no matter if everybody else around you says it's fine, they'll grow out of it. There's zero harm in bringing your kid in for an evaluation for whatever specialist that they need to see. So it's much better to go see somebody and have them be like, nah, they're fine. They don't need to see me. And good doctors, good specialists, good providers do that. They don't just want to see you for no reason. Than to wait and try to fix something after it has been ingrained neurologically in that kid for 3, 4, 5, 6 years.
What could that be?
So that could be a speech issue.
Okay.
It could be a motor issue, so a movement issue. It could be sometimes some kids have low muscle tone, so you'll notice that they can't do things lots of other kids can do. So let's say in middle school, everybody can do a cartwheel, your kid can't. You're like, something's up with that, And so instead of being oh, that kid just doesn't do that, it's fine to get an evaluation and then get some things to do at home. And also it could increase that kid's confidence, which is worth a lot.
So a cartwheel, their arms are just floppy or they can't hold themselves. Because, not all kids can do the perfect little cartwheel,
totally.
But more of the physically wouldn't be able to hold themselves up to do it.
Correct.
Okay.
Or even little things they notice this in schools, public school is really great with this. But if a kid can't hold their pencil properly or they can't write their name clearly, they'll usually bring somebody into school because the teacher will notice. But if your teacher doesn't notice and you notice as a parent, you mention something to the teacher. So every person that's a provider for your kid is not necessarily in the medical field. It could be the teacher. It could be the teacher that finds the issue or that she's the person that you need to speak to get the right care for your kid.
let's talk a little bit about preventative care. I mean,
Yeah.
because in so many ways, that is an important part of the overall health of our kids.
Yes. Preventative care is the best thing ever.
Okay.
The
best thing ever.
It is the best.
Okay.
So it's much easier to prevent something from happening and not have to fix it as it is to like fix something. So think if your kitchen is clean, it's just clean. Like you don't have to do anything. But if your kitchen is a nasty, nasty mess, you got to clean it up. And that's how it is when you have an issue. So let's say it's an ergonomic issue and you have never addressed it, meaning like your kid's posture is really bad and you just think, oh, they'll grow out of it, right? If you never see somebody for that, their posture is going to always be really bad. And then they're going to have to try to fix that later in life or not fix it and end up with different problems. So prevention, an ounce of prevention is worth a pound of cure. That's the gold standard of what prevention is.
Well, and that's a saying that's been around forever, but there's something to it.
Yes.
Yeah. So preventative care is key. It made me think too, like just, in your line of work as a chiropractor, what kinds of things do you see when parents are coming in with their child?
So when I see babies and they come in, a lot of times I'll see babies at their developmental milestones. So when they sit up, when they crawl, when they start to cruise along furniture, and when they start to walk. And then we see them like once a year before they go to school. Usually I like check their backpacks, make sure it's not like 50 pounds and ruining their spine.
Actually, that's a side note, but some of these backpacks, the way that kids walk around with these backpacks, that actually could be long-term damage, couldn't it?
Oh, it's horrible. Yes. Like the one strap thing that could be a whole nother topic.
Okay, we are going to actually dive into that topic. Oh my gosh, the backpacks.
Yes.
Okay.
Yes. So to take care of those issues immediately is very, very helpful. And then just getting checked regularly. So even, we're talking about kids, but like even in geriatrics, think of a geriatric person that's having like a mental problem and they're like having some developmental thing. If they get checked every like 6 months from a developmental person and a mental person, let's say it's like a vestibular therapist, they will do much better than somebody that just like lets it go, right? Getting a check-in is amazing. You should get check-ins. That's why we have doctor's appointments every single year. That's why you go to the dentist every 6 months. Like you just do these things. Prevention is what you should be doing. Yeah.
If there was one takeaway when it comes to understanding all the different providers, how we are choosing the right provider for our family, what would that be?
Find somebody that you're comfortable with, that you can talk to, and that is well connected in the community that you're in. Your primary care is lovely, but you always want to make sure that whoever you're seeing is well connected. So if they can't treat you, they can connect you to somebody else. Yeah.
That's key. All right. Dr. Coffin, thank you so much. Really appreciate it. And we'll let all our listeners know too. We will have more resources on this on our website, wgme.com/raisingme. Thank you so much.
Thank you.
All right, so a few big reminders and takeaways in this episode. First, how about that pro tip from Dr. Coffin? Instead of going to your pediatrician first for a specialist referral, just try reaching out to the specialist first directly. They can often contact that pediatrician for you, which could save a lot of time navigating the system. Of course, Dr. Coffin also reminded us of the importance on relying on those referrals from family and friends when trying to find a specialist or really any provider. Hear those real life reviews from those who you trust. And then when it comes to finding the right mental health provider, she talked about finding someone who specializes in your child's age. For example, she talked about play therapy, often best for kids, say, under 10, while older kids may benefit more from a regular therapist. But really finding that right therapist can be very difficult and takes some time, actually. Of course, we've talked about this on the podcast. There's just such a need right now. A lot of kids need this kind of support. Above all, as parents, the most important advice to underline, listen to that inner voice. If you think something might be off, I mean, what's the harm in getting it checked out? Whether it's a speech delay or a motor skill question, preventative care, as docs like Allyson say, an ounce of prevention is worth a pound of cure. Thank you so much for listening to Raising Me. I'm Adrienne Stein. This episode is edited by Megan Littlefield and produced with Nate Eldred. Please follow Raising Me wherever you get your podcasts. And of course, we would love if you give us a positive rating and review so others can find the message as well. Wherever you are, I hope you learned something new and get to take a little time for you.